Global coronavirus infections have climbed past 20 million, doubling in just 6 weeks. And more than half of those positive cases come from just three countries: the US, Brazil, and India. Since the first cases were detected here in the U.S., more than 5 million Americans have been diagnosed with the deadly disease, and at least 164,000 have died. So Dr. Neeta Ogden is joining us from New Jersey to break down all the latest medical news pertaining to the coronavirus. So, Doctor, a recent Washington Post article suggested that maybe the key to ending this pandemic has to do with the asymptomatic people who have contracted the virus but are not showing any symptoms and not getting sick. And in fact, there are maybe many more of them in this country than we are aware of. Now, I throw into this question the fact that we've seen studies that indicate that immunity may or may not last that long. We really don't know how long immunity lasts once you've been exposed to the virus. So I ask you, could asymptomatic coronavirus positive people lead to an end to this pandemic?
Well, good morning, Anne-Marie. And this is a really interesting topic that's emerging from a number of studies now that are looking at different parameters in immunity. For a long time now, we've heard about antibodies and antibodies. Well, we know that the immune system is far more intricate and vast. And these studies are talking about memory T cells. Specifically, they're suggesting that this asymptomatic infection, which we're now seeing play out in so many different scenarios, the Diamond Princess, Boston Homeless Shelter, Tyson Poultry Factory, just to name a few, where there was a high level of infection and a great percentage of people who were asymptomatic. This kind of diversity of infection, how do we explain it? These scientists are suggesting that memory T cells may be at play here. So how does that work? Well, we know that the coronavirus is one member of a larger family, and 4 coronaviruses in that family actually lead to mild illness, like a cold. It's likely that people all around the world have been exposed to those coronaviruses and now have these memory T cells that are able to interact and defend against COVID-19. And what we're seeing here is that those memory T cells may be playing a role in what we call this type of partial immunity. They may be the reason why some people are asymptomatic or have this more mild course. However, of course, this is still kind of early speculation, so it's not necessarily clear that this is exactly what's at play. People suggest there are other things that may be involved, like viral inoculum, where we see masks actually playing a role here. If you have a lower viral load, do you have a more mild illness? Genetics may be an issue here. So there are other factors at play. It may not just, but this is actually a huge breakthrough in getting away from just the antibody discussion. And it also speaks to what we're looking at in the vaccines.
It's all interesting stuff, though. So before we were talking about the coronavirus on a regular basis, one of the other health crises that we were dealing with here in this country had to do with teens and vaping, and the number of teens that were winding up in the hospital with debilitating, lung damage because of widespread vaping. People always talk about how headlines just seem to sort of disappear sometimes when something else replaces it. But I presume that teens are still vaping, and now we're learning that they may be more susceptible to the virus.
Yeah, exactly. And this is an alarming study from the Journal of Adolescent Health. Study was conducted by Stanford scientists doing a survey, and it's actually leading, lawmakers to urge the FDA to remove e-cigarettes immediately from the market. Why? Because the study showed that in young people, ages 13 to 24 years old, who so far, there's been this message that they're not as vulnerable to the disease. Well, if they vape and use cigarettes, they're 7 times more likely to become infected with coronavirus. And if they use e-cigarettes alone, 5 times more likely. So it's a very alarming thing that's going on. And it really, says that we should be making a public health effort to warn young people about the dangers of this, because obviously e-cigarettes are damaging their lungs and it makes them more vulnerable to infection. They could also have a harder time battling the disease and lead to, some of those long haul symptoms that we're hearing about from coronavirus.
And someday we will talk about that. What happens once you recover from the coronavirus? And is this country equipped to deal with the needs of those people? So this is a headline that really sort of got my attention. It's about face coverings and which ones are the most effective and the least effective. And so there's this new sort of face covering that has come out called a neck gaiter. People have probably seen it. It's kind of like a piece of fabric that goes around your neck typically, but then you can like pull it up over your chin and your mouth and your nose. And people have been using that as masks. But now we have a new study indicating that not only may they be not effective, they may be worse than not effective. What do we know?
Right. They may be worse or the same as not wearing a mask at all. Yeah, this is an interesting study that spoke to a very easy way to look at droplet transmission and mask efficacy effectively. And what they found was exactly what you're saying. You know, on one end of the spectrum, we have obviously the N95 masks that are meant to be PPE, surgical masks. And then at the other end is the no mask. And along with that, in that area are these kind of fleece gaiters that a skier would wear, for example, and those bandanas that sort of hang loose and don't properly cover along the chin. So it's important that we start looking at the efficacy of masks as people go back to school, and there's mask mandates, at least at some schools, because you do want to see what's going to help prevent the spread of coronavirus. So more like cloth mask, and they said, poly cotton masks are things to look at with the proper ear loops rather than gaiters and bandanas.
Doctor, did the study have an explanation as to why the gaiters didn't work as well? Bandanas I can understand because they are loose at the bottom. So of course there's all this, the air and droplets coming out of the bottom for a bandana, but the gaiters seem like they should be secure.
I think a lot of it has to do with the fabric that we're seeing most gaiters that are made out of. Along in that spectrum, and that end of the spectrum that was not effective, were knit masks. So it has something to do with how they're made. And certainly, it's important to look at individual products. Potentially there are gaiters that have, but there is something about the looseness of the way it hangs on the body too that may affect droplet transmission.
Okay, very quickly before we let you go, I want to ask you about this announcement out of Russia about this vaccine. The vaccine has not gone through phase 3 trials. The Russians are insisting that it is effective, and what would be unethical is to withhold a vaccine like this from the rest of the world if they felt that it could be useful. What's your take on this vaccine from what you've heard so far?
Well, I think that Dr. Fauci actually commented very accurately that it's two very different things to have a vaccine and to have a vaccine that's safe and effective. This vaccine, there's no data on it. I mean, you can see that on a weekly basis in the United States, we have phase 1, phase 2. It's a very gated system. And only until phase 3 is completed can we really approach the FDA about safety and efficacy. Well, obviously, this Russian vaccine has provided no data, and they're only starting phase 3 trials now, which is how you actually show that it's safe and effective. So I don't see how we can take it very seriously, and I think it speaks more to this, global and political competition to be the first one with that vaccine. At this point, I wouldn't take it, and I don't think many people in the scientific community at large deem it in a very serious light.
All right, Dr. Neeta Ogden, thank you so much.
Thank you for having me.